Okay, good morning, good evening, doctors, nurses, and pharmacists. I'm Dr. Che, and today we will discuss some important reading tips for doctors and nurses, those who are taking OET exam. So we have already discussed yesterday some important reading tips. So today we will continue. So if you can hear me on Facebook, please write some comments. And if you can share this session with other doctor, nurses, and pharmacists, that would be great. Okay, so we are going to start the session very soon. Okay, I hope yesterday you have enjoyed the tips that I have given. So anybody can just give feedback about yesterday's class. So anything specific that you want me to discuss today? Okay, so first we will complete yesterday's reading part A, and then we will continue. Okay. Just watching your. Okay. So this was reading part A that we have discussed yesterday, a lot of questions. So we will continue okay. So we will continue the same, and then after at the end we will discuss some uh, reading part B questions. Okay. So if you remember yesterday, first we need to do skimming and scanning. So most of you have done this. So it is very easy. This topic of this sample is lumbar puncture. In text A, they are talking about in general what is lumbar puncture, what is the reason of lumbar puncture, why we do this, what are the examples, and what are the contraindications, how we manage the side effects of lumbar puncture. And then in text B, we have a column, a table in which we have types of meningitis: viral, bacterial, TB, fungal. So then we have lumbar puncture interpretation: pressure, WCC, prominent cell type, glucose level, protein level, further tests. Then in the part C, text C, please mute. In the text C, we have the text that is about post LP. LP mean lumbar puncture. So post lumbar puncture, headache. So what are the risk factors, how we manage, how we prevent, how we treat it, okay? And then we have in the text D, we have future developments that we have about uh, lumbar puncture, the future developments. So most of you have discussed this yesterday. So now we are going to do further questions, okay? So the question number 12 we have discussed yesterday. Which type of meningitis? The prominent cell type is lymphocyte by pressure is above. Okay, just 1 minute. So we have discussed, the last question was question number 10. Yes, question number 10. If anybody remembers well, what was the last question? I think was the question number 10.
Unfortunately, I couldn't join yesterday, so that's why it is my first lesson.
Okay, no
sorry.
problem. No problem, but you can participate today actively. Because
Yes,
mostly
we did 10 to yesterday.
10, the question number 10 we have done yesterday. Okay.
Yes.
So question number 11, headache is a frequent symptom after lumbar puncture if dash is not considered. So in which text it is possible? In which text it is possible to find the answer? Write in the chat, please. In the chat. Headache is a frequent symptom after lumbar puncture if dash is not considered. In C. So in which text it is possible? Just an idea where it is possible. So headache means this is a symptom and something that, you know, is frequent after lumbar puncture. So most probably, let's see. So it could be in C or A, okay? In both is possible. In C or A, okay? So let us go first for A, for C, okay? C. So this is your question. Let me make it a little bit small. This is the question. And here is the text. Try to find the answer, please. The question is at the end. This one. Headache is a frequent symptom after lumbar puncture if dash is not considered. Okay. Can you find the answer here in text C? You need to be very quick because if you spend a lot of time, you will not be able to answer all the questions in 15 minutes because you have 20 questions to answer in 15 minutes. So no, so answer is not here. Let us go to other text, text A, try to find the answer here. Here is your text, here is your question. So please try to find the answer. So what are your keywords? What you are looking for?
Headache.
Headache. What else?
A small
persistent,
small traumatic needle is not used. This is the answer.
Frequent symptom. It should be a frequent symptom. If something is not considered, so headache is a frequent symptom. So frequent mean more often. So there would be something, you know.
Small. Where is the
small
automatic needle?
Yeah, please write in the chat. So once I ask somebody to discuss, then you can discuss. First, try to write in the chat.
Are you seeing our answer, Dr. Che, please?
Yes, please. Yes, I can see your chat.
I
Yes.
wrote here in the chat box that
Yes,
it is
I
a
can
small
see.
traumatic needle. This is
But
the
we
answer.
don't, so we are waiting for others to write their answer, then we will discuss. Okay? Because this is the way.
Okay.
Some of you are, a little bit quick in finding the answer. Some are a little bit, slow. That is why we give time a little bit.
Small traumatic needle now.
Its intracranial pressure should be considered before.
So please write what you will write in the fill in the blank. What you will write. Okay, just write in the chat what you will write in the.
DrChe?
Yes, please.
Yeah,
So
here
now
is the
you will
keyword.
discuss. Okay, so who is talking? Let me see. Yes,
The
Nata
keyword here. The
is
keyword
iPhone.
here.
Your name shows iPhone. What is your name, please?
Yeah. Swat. My name is Swat.
Okay, Swat. Okay, Swat.
Yeah.
Swat Ahmad?
Here the yeah.
Swat Ahmad, okay.
Thank you.
Okay.
Here the keyword is if after lumbar puncture, if something is not considered, I think this is the keyword here.
Yeah, this and one other thing is headache
A
as a
frequent
frequent
symptom,
symptom.
Yeah.
Okay. So what is the answer?
Small traumatic
Yeah.
needle.
So your answer is here.
Yeah.
This is headache is your one keyword. Other keyword is common side effects. What synonym I'm using instead of common side effect?
Frequent symptom.
A frequent symptom. I'm not using side effect. I'm just using symptom. Instead of common, I am using frequent. Instead of side effect, I am using symptom. Because side effects are overall, if it is side effect, it is a symptom, okay, overall. For example, if I experience pain, it is a symptom, okay. So if I have vomiting, this is a symptom. It could be a side effect, but overall is a symptom. So I am using synonym, okay, similar word, similar. So frequent symptom after lumbar puncture, okay. So
it means complication, yeah.
So post-dural puncture means after puncture, after lumbar puncture. If something is not considered, if a small traumatic needle is not considered. So it means if you don't use small needle, then headache is common. Okay.
It is small, traumatic, yeah, with yeah.
So yes, small or traumatic needle. Yeah. With yes. Good. Thank you.
Thank you.
So most of you are writing traumatic. So it's traumatic. So means the needle that makes less trauma. Okay. The small, maybe small size. Okay. So first thing, let me tell you what is the strategy, what is the examiner as this model, this sample is written by myself. So what I want from this question, these are the things to discuss, the tips and the things that can help you in the exam, because overall you have a lot of samples to practice in these things. Number one, I have used headache. Okay, headache. This is a side effect. And if you see here, this heading is post LP headache. So it's most probably 90% of you after reading this question will go to text C. 90% of you after reading question number 11, you will go to text C. So you will go there, you will spend some time to find the keywords, to find the answer. There would be no answer in text C. Then you will go to text A, you will try to find the answer. The answer is hidden here at the end, just in one sentence. So you will spend a lot of time. Even the answer is very easy. The question is easy, answer is easy, but you will spend some time on reading, text C and then reading text A. So this is what you need to do. Just quickly skim and scan in text C where you can find the keywords or not. And then if not, then go for text A and then quickly find the answer. This is what I want to teach you. So the next is in which type of meningitis the prominent cell type is lymph, okay, lymphocyte, lymph, but pressure is above 30. So in which text you can find the answer? Write in the chat, please. So in which text you can find the answer? Please, those who are on Facebook, you can write your answers, your chat here. I can see your comments also. Sadi Ahmad, Sham Khan, Chris. Okay, I can see your chat. So people, those who are on Facebook, you can write your answers in the chat. Okay, I can see your answers. So it's very easy. Answer to this question is in text B in the table. Let us copy the question and nobody will tell me the answer. You will write in the chat. Okay, you will write your answer in the chat. You will not give answer here. You will write the answer in the chat. Okay, text is B. Now try to find the answer. Those who are on Facebook, you can write the answer in the chat. Those who are on Zoom, you can write the answer in the Zoom. Okay, on Zoom in the chat. Okay. So please write in the chat what is your answer quickly. No, text is B, but you need to find the answer, exact answer. Give me the exact answer. Danish Bhatt, can you hear me? Danish Bhatt, can you hear me? Yes, can you hear me? Can you
Yes,
hear
sir,
me?
your voice is clear. Yeah, your voice is clear to me.
Okay, so what is your answer, please?
I answer for this one, the epidural brain abscess. The reason is that above 30, pressure is above 30.
So
So,
above 30 means 31,
yeah, 30
32.
plus. Yeah,
So what
I
is your
understand.
approach? What is your approach to find the answer? How you will do? Because this is the question. After reading the question, what will be your approach to find the answer?
So the keyword will be 30th. So I have to go with the pressure is mentioned here with the figure of 30s. We'll look for the number. So
Okay,
they wrote here
let me
already.
explain you in easy
Yeah.
words. So
Yeah,
first,
please.
there are two things. First, prominent cell type is lymph. Okay.
Okay.
So you go into the column of prominent cell type, find where is lymph. Maybe lymph is only in one option, but if you
Yes.
go here, lymph is written in 1, 2, 3,
All the
4,
columns.
5, 6. Okay, except the first one. Okay.
Okay.
Yeah. Okay. So now it means you cannot differentiate between which type of meningitis the prominent cell is lymph, because most of them have prominent cell type is lymph. Okay. Now the next thing is pressure is above 30. So where is the column of pressure?
Yes. The second one.
The second one.
Yes.
Okay.
So
Second
above,
one.
actually, I was
Yes.
confused with the above
No,
30 and
someone has answered cryptococcal plus bacterial. Okay.
yes.
So bacterial is pressure is above 30. But you cannot see the prominent type of cell is lymph here, lymphocyte.
Yes.
So bacterial meningitis is wrong. Even the pressure is above 30, but you cannot see the prominent cell type as lymphocyte. So this is wrong. Bacterial
Yes, sir.
meningitis is wrong. Okay. Now let us go to brain abscess that Dr. Danish Bhatt has given the answer. So your prominent cell type is lymph. but your pressure is from 18
Between 18 to 30, yeah.
30. So, but in the question I am using
They mention for the
above
above.
30.
Yes,
So
Just cryptococcal meningitis is up.
it's
meningitis,
only
yes.
the 30 plus means 30
Plus
and
in
above.
above,
30
yes.
and above. So this is also 18 to 30. This is 18 to 30. This is less than 30. Okay, it's 20, 20 here, 20 here. No. So all of you know the answer. No, let us make a new question. Okay, this is how we make the questions. Okay. What is the answer? No, what is the answer? Please write in the chat. Don't write directly here. Write in the chat. We have new question here. Write in the chat. What is your answer? Write in the chat. What is your answer? Very good. Okay. So people on Facebook, please try to participate actively. Write your answers. Okay. Otherwise, we can go offline from Facebook because we have almost above 40 students with us on Zoom. 43 people, sometimes 45. So please try to find the, give answers and try to participate actively. So that the purpose is you people can learn something. Otherwise, you're just listening and just, okay. No, you can see this just, I have just added, how many words I have added in the previous question? Can anybody unmute and talk with me?
Only one word, sir.
Only word, one word. The cell is not lymph, but pressure is above 30. In which?
Bacterial.
So first let us see in which is pressure is above 30. So above 30 is here in cryptococcal
But it's
and the pressure is here in bacterial.
but
So
not
N2, okay. So now the prominent cell type is lymph here, but I am saying not lymph.
then it is
It
bacterial.
means my answer is bacterial. You people can see how the things change with just a small, change. The answer changes completely. Please try to, practice these things when you are doing reading samples. Try to, do critical analysis of your questions and, answers and your texts. Okay. Otherwise, you will be people doing a lot of questions and sample at the end. You will say my reading is not improving. Okay. So next question, a procedure in which blood is inserted in extradural space. Where is possible? In which text is possible to find the answer? A procedure in which blood is inserted in extradural space. In which text it is possible? Please try to write in the chat in which text it is possible. Somebody is asking in the chat because in bacterial types is polymorphonuclear. Okay. But here I have said not lymphocyte. So when I'm saying not lymphocyte, it means it could be something else, not lymphocyte. Okay. So where we can find the answer, a procedure in which blood is inserted in extradural space. Okay, D. Let's go for D. Most of you are saying D. Try to find the answer here. I have copied your questions. So can you find the answer in the text D or not, please? If you can find, what is the answer?
I don't think so. The answer is here. I cannot find.
CRA, people are saying CRA.
Because we are not able to see the text, the whole text, A, B, C, D. I'm not sure.
So no, just you need to just guess in which it is possible. Then we go to that text.
I
If
think
you
it is
cannot find,
A.
okay, let us try in A, okay? Because I cannot show all the text at a time, okay? This is the problem. And the real exam, you also need to first guess in which text you can find the answer. You need to write the answer in the chat, please. Yeah, very good. So, Miss Jivanti, can you hear me?
Yes,
Miss
sir.
Jivanti?
Yes.
Okay,
Yes.
so what is your answer?
Epidural blood patch. And
Where is the
epidural.
answer?
It's third para. Managing side effect. It's third para.
A procedure called epidural blood patch. This is the name of the procedure, epidural blood patch. This is our answer. In which your own blood is injected into the theater sac, may relieve your headache as it slows down the leakage. So answer is that. So the answer
So
is
it is in
easy,
A,
but
yeah.
you will, answer is easy, but believe me, in the real exam, when you will be under time pressure, you will spend a lot of time to find the answer. So this is you in the reading part A, this is not only the test of your reading skill. This is a test of time management also, because you have to answer 20 questions in 15 minutes. And Miss Yvonne, just can you give a little bit feedback about your writing and about your friends, just if you wish, otherwise no problem.
Yes, actually, I'm really helpful your writing course for me and my 3 friends. We all got B for writing.
And what were your
After,
scores in previous attempts?
I had 280.
280.
Yeah,
And your
actually
friends?
my friends, one had 260.
260 and other?
Yeah, other one of my friend that last our exam was last February. One of my friend, that was her first attempt. She have never taught OET. This is the first time she learned OET letters from you. Yeah. Then we all could pass our writing with B grade.
With B grade, all of you with B, okay.
Yeah.
And you
Yes,
know,
sir.
what is my, I'm worried. So all of you got B, and if you people take any next attempt, maybe due to other modules, you need to maintain this B grade, because it is very difficult to maintain B grade.
Yeah.
Okay.
Yes,
So
sir.
these were the 4 friends. They joined me together for writing course, VIP hybrid course. Please, there is some background noise.
Yeah.
Okay,
Okay.
and then in the real exam, you people got B grade. All of you got B grade in writing. That is very good. So this is called VIP hybrid course. So if Miss if you remember well, I did not. I mark a lot of letters in the course.
Yes, yes.
Are 14 letters, but I keep helping my students till their exam.
Yeah, yeah. Yes,
Okay, so next
actually,
question is yes.
yeah, before I'm going to the exam, I got correction more than 20 letters from you. That's
Yeah.
it. I did before the exam. That is
Yeah.
very helpful for us actually.
Okay, thank you. So next question: in which type of meningitis WBC's count is up to 300 per ml? Glucose level is normal and gram stain is negative. So we will go to text B. All of you know that the answer is in text B. So here is your question. Here is your text. Try to find the answer. Okay, I'm coming back. I need to see a patient. Try to find the answer and write in the chat. What is your answer? Write in the chat.
Yeah. Hello, DrChe. Hi.
He went to see his patients.
Oh, okay. He's not here.
No, he has a patient. Maybe he will come back.
Yes,
He's a doctor, GP, yeah?
yes, he is.
Oh, she is or he is? He's a man.
Please, please, please. Okay, so
It's Hippocrates. It's not just a man.
Don't discuss teachers
please.
thing.
Okay, so
Dr. Chi,
here, Yes.
Can you
Yes.
hear us? Yeah.
Yeah, I was just seeing a patient, please. Okay. So let us just focus on question. Okay. Okay. So our question is, in which type of meningitis WC count is up to 300, glucose is normal, and Gram-10 is negative. So can anybody tell me how you will approach this question? Just we need to find how you will approach.
I can say.
Yeah. Yes, please. Yes.
I decided epidural brain abscess because
No.
of.
So first, how you will approach? How you
I
will
will tell
approach
you
this question?
because of normal glucose and
No.
gram.
Wait, please. Wait, please.
Okay.
So how you will approach? First, you will read this question.
Okay.
Then what you will do? What you will find first? Glucose normal or stain or WBC?
300 first of all.
I will go for the column of WBC. Okay.
Yes, that's
then
right.
I will find where it is up to 300.
True.
So it could be 300 here. It could
Yes.
be not here. Here.
No.
Could be here. Could be here. Here, no. It could be here. Or it could be here. Mean it could be in lot of them. Okay.
True.
No. Next.
Sorry, Dr. Che. Bacterial meningitis. It is also from less than 100 to 10,000. So it means more than 3.
Bacterial.
Yeah. Well, I didn't choose this one, but I mean, this is, we can also.
Yes. No. It cannot be. It is less than 100
to
more
than
it could
10,000.
be. Okay. So, but then glucose normal. Okay. In which glucose is normal?
Two normal.
We have two normal.
Yeah.
We have two normal, Lyme, and then we have epidural.
It
means our answer is one of them, not others. Okay.
Yeah. I choose like this. Yeah.
We need to decide between if it is Lyme or it is epidural. Okay. Brain abscess.
Yeah, it is the quickest way, I think. Yeah, by Gram-10 and by.
Yeah. Then we will go to Gram-10. Okay. So Gram-10 will be in the further testing.
Last one.
Okay. So A/B testing. Just 1 minute.
Hello.
He left.
Okay, so next we need to find in which column you can find that the Gram-10 is negative. So Lyme here, A/B testing paired with serum through poor sensitive. There's no mention of Gram-10. That is negative. Gram-10 not sensitive. Not sensitive means
negative.
Okay. So our answer is
brain abscess. Yeah, epidural.
Brain abscess, epidural, or brain abscess. So you will just copy and paste this. Okay, epidural / brain and abscess. So our purpose is not to do a lot of questions. Our purpose is to approach. So to approach here in the table is very easy. You need to find the type of meningitis that is here. Then in which WBC count is up to 300. So it could be here, it could be here, not here, and here. Okay. And then glucose normal. Go to glucose is normal here, is normal here. So our answer could be Lyme or epidural. Then Gram-10 is negative. So it is only in this, the last one. So this is how we approach the questions in table. Okay. Okay. The next question is, caffeine was found to be effective is relieving some grammatical mistake. Caffeine was found to be effective in relieving post LP headache by something. Okay, so it would be in text C. In text C. Okay. So try to find the answer here.
By reduce is the
Please just write in the chat, please. No,
okay.
chat only. So your keyword is caffeine. No. The increased production of CSF, it is in the above. Okay. Okay. So it could be this one. And here they have mentioned something about caffeine here. Caffeine can also relieve pain and help promote. No, this is not. No, it was found to be, they mean they are talking about some review. Okay. Was found to be effective in relieving post LP headache by this review. Okay. Cochrane review. So the answer is this review. Okay. It's an easy question. Just you need to be a little bit quick. Next question is, lumbar puncture helps doctors to diagnose disease of dash and dash. In which text you can find the answer? In which text? Just quickly, please. In which text?
A.
A? Okay, so most of you. Don't tell me something. Just write in the chat. Your answers should
Disease
be in
of
the chat.
central nervous system.
Please.
Oh, sorry.
Please. In the chat only. Try to find the answer. This is your text A. Try to find the answer right in the chat. What is the answer, please? Those people who are on Facebook, you can write your answers in the chat. I can see your chat. Miss Sadi Ahmed says meningitis and brain hemorrhage. Where is written meningitis and brain hemorrhage? No, these are the examples. I'm asking disease of dash and dash, so the answer is here. So the main reason of lumbar puncture is to help diagnose diseases of central nervous system, including the brain and spine. Okay. The answer, lumbar puncture helps doctors to diagnose the diseases of brain and spine. So answer is brain and spine. The answer is brain and spine. So if headache is resulting nausea, maybe in here, in nausea, dash could be helpful. So where we can find this answer? I think in text C, yes? So here is your question. So the answer is very easy. IV fluid here. Your keywords is nausea. If the headache is resulting in means causing. If the headache is causing nausea, means if headache is resulting in nausea. So there is no evidence to support their use, but maybe help in headache in causing nausea. So intravenous fluids. So answer is intravenous fluids. So the next question. In future, those people will be doing. In future, those people will be doing LP procedure who are competent in spinal puncture and dash. It's very easy. And text D. Try to write the answer, please, quickly. Quickly, please. Try to find the answer quickly in text D. Write in the chat. Quickly, please, quickly. Okay. So very good. Okay, so answer is here in the last line. However, therefore require the procedure to be concentrated in the hands of people who are both competent, mean they are good, okay? They're competent in ultrasound localization and spinal puncture. So I have written spinal puncture. So the next answer would be ultrasound localization. A dash and thecal sac should be suspected if pain persists for a long time. So it's very easy. It would be in the post LP. Try to find the answer, please, quickly. Can you find the answer in text C? No.
No.
I think no. So let us go to here. Here, you can find this.
A hole, a hole,
Yes.
a hole.
A hole in thecal sac, just a
Yeah,
hole because thecal sac is already written. A
yeah.
hole in thecal sac should be suspected if pain persists for a long time. So the last one, post LP headache can be prevented if needle has. It's very easy here in the last here. Try to find quickly, please. What is the answer? If the needle has this is what I was expecting. Some of you will give the answer 22 gauge. If the no small size, no. So some of you will write the answer 22 gauge. That is wrong. If the needle has a traumatic tip, can prevent it, the thin needle with a traumatic tip has a traumatic tip. A traumatic tip is the answer. You need to fit the answer grammatically. So it should be a traumatic tip needle. So at the end, just quickly, if any of you wants to join our VIP hybrid course for writing, that is one of the best, writing course for OET. So you can join, okay? So this is VIP hybrid course. 14 letters will be corrected. There are different types of letters: 3 referral, 3 urgent, 3 discharge, 2 letters to non-medical professionals, 1 letter is to pediatric patient. In 1 letter, there are 2 patients. In 1 letter, there is GP to GP transfer. In case of nurses, is 1 community nurse to another community nurse transfer. So this complete course, mostly, these are 14 letters, but mostly I keep helping my students till their exam with more corrections without extra charges. And we have speaking feedback available, and only writing correction is also available, £5 per letter. So if you need any kind of help, please let me know. Thank you so much, all of you. So our next free class would be about writing. Our next free class would be about writing. I will announce the date, when, the day, and I will send a message. So next class would be about writing. I will send case notes, and you can write letter and you can send me. Thank you so much.